Hey, it's Michael with Total Physical Therapy. Today I'm going to cover a recent conversation that I had with an individual. I crossed paths with this individual that happened to know that I was a physical therapist, and they were asking me to help give some guidance on some elbow complications that they're dealing with. So to set the story, this individual was dealing with complications on the inner part of the elbow as well as the forearm. It started 5 months prior as a annoyance, something that they tried to ignore, and that annoyance progressed to something that was come and go, off and on, periods of sharp, intense pain, and had now kind of progressed to more of a consistent ache with loss of motion in the elbow, the forearm, and most importantly, difficulty grasping and holding on to things with their hand, ultimately affecting their ability to carry out occupational as well as common daily tasks. And so this individual described these symptoms starting 5 months prior, and that was one of the things that I really keyed in on, was the timing of the situation. Now, there's a few things that can be going on these areas of the elbow, but what they were describing was some type of tendon complication, and maybe where that tendon inserted on the actual skeletal or bony tissue. But after a few little tests and poking and prodding, it was pretty clear that the problem was in the tendon. And so my next question was to identify what they had already tried and what had been the result of any of that stuff. And I think this is important because this is where a lot of people start with. So the first thing was just ignore it. And they probably did the right thing and just kind of giving it a few days to just see if it would go away. There was no harm in that. The next thing that they tried to do is they tried to modify anything that they felt was aggravating the symptoms. 2 thumbs up there, because anytime that we're dealing with the tendon issue in the early phases, we want to try to identify what is irritating it. So they had done the right things from that standpoint, and then they went on to over-the-counter anti-inflammatories, over-the-counter pain medications. They had tried epicondyle relief straps. These are compressive devices that go around your forearm. None of that was working, so they consulted with an orthopedist that administered a steroid injection. That came to no avail, and so now they had developed these consistent morning tightness and stiffness in the forearm and the elbow, as well as what they felt was stiffness through the hand. And so they were considering to splint the hand in an open position to try to prevent that increased tightness in the morning. So bringing this all back together, the whole resonating picture of this going on for 5 months brings me to a conclusion that we have now left an acute phase of a tendon issue, and we have moved well into what would be considered the chronic phases. Now, in this case, given his signs and symptoms and the time period, he has now entered into a state of tendinopathy. And tendinopathy, understanding what it is and how to go about healing it, you have to first understand what the tendon is actually designed to do. All tendons in the body are going to connect a muscle to a bony tissue, and those tendons are responsible for holding tensile forces or holding a load that the muscle places on a bone to move it. It's just quite simply what a tendon does. And when we get into these states of either a tendinitis or a tendinosis, tendinopathies, all of these conditions ultimately need some degree of loading to that tendon. And again, as I stated, they're designed to experience tension. So if we don't put tension on a tendon, at some point, we're seriously incapacitating the ability for the tendon to heal. And so I described this to this individual, told him that my next course of action would be just find the threshold that we can start introducing some exercise that is tolerable, not symptom-free, but tolerable, and doesn't create an adverse effect for the next 48 to 72 hours. And so I gave a couple examples of some exercises to do, and after giving that explanation, this individual said, "Wow, that was completely opposite of what I thought I needed to be doing right now." The public thinks that to help heal a tendon in a chronic state of complication, means to avoid movement, and it's quite the opposite. And so this was a great learning experience for not only this individual, but hopefully a great learning experience for you to understand that there are time periods where we need to pull back, but there are also time periods where we need to move forward. And in this particular example, I strongly feel like this individual needed to move forward. We needed to identify what we can do currently from a state of exercise that does not over exaggerate his symptoms, but just creates that tensile stress to the tendon, because ultimately that is what forces that tendon to come to a full resolve. Now, we have other videos where we discuss in more depth the subject matter of tendons, but it's a fascinating topic that so many people fall into this gray zone where they avoid stress when they need to be applying it. So share with me your moments of dealing with tendinopathies, how you've overcome it, what have been some of your shortcomings, and we can all get through this together. Hope you enjoyed the video. Give me a thumbs up to prove that you enjoyed it, and we will talk to you next time.